welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Teresa Fuller. She's a pediatrician. Her Kevin MD article, which we'll talk about today, is titled Reversing the Impact of the Pandemic on Childhood Obesity. Teresa, welcome to the show.
Thanks, Kevin.
We'll get into the article in a little bit. First off, briefly share your story and journey to where you are today.
Well, I've been practicing pediatrics for the past 20 years. Initially, I practiced acute care medicine. I was a hospitalist for about 10 years. And then about 10 years ago, my focus in pediatrics really changed to more of a preventive care as I developed an interest in integrative and holistic medicine. So I was interested in how that applied to pediatrics. So I changed, I would say, over the second half of my career. I've been working more in primary care, both in traditional practices and once in a holistic integrative practice. Currently, I'm in a traditional practice, and I try to incorporate for my families a holistic approach to their health care.
So when you talk about a holistic approach to pediatrics, tell me what that would look like.
For me, what I focus on mostly is nutrition. I try to really empower my families with information about healthy eating, healthy lifestyle, especially for kids, really just a general healthy lifestyle of exercise, getting outside, getting outdoors, overall healthy eating, and just a positive home environment.
So it sounds like a lot of that also can be applied in a traditional pediatric practice. So what more can you offer in a holistic practice that you can't offer in a traditional pediatric practice?
I tell my patients, my families, that really, to me, it's mostly the same thing, because as pediatricians, that's always our focus, is a healthy lifestyle. So the only difference, I would say, is just that I have the training that I had in learning more about some of the specific ways that nutrition impacts health, nutrition impacts our psychology, how nutrition and nutritional supplements can help. I would just say that I have some more formal training in that. But you're right, this is what pediatrics is all about.
All right, and we're going to talk more about that in your Kevin MD article. It's titled Reversing the Impact of the Pandemic on Childhood Obesity. Now, for those who didn't get a chance to read your article, just walk my audience through it, share the story, why you decided to write it.
I think the article was initially motivated by my observation that during the pandemic, my patients were gaining weight at dangerously high rates. And I did some research and found out that this was an actually observed trend all over. It turns out that while the prevalence of childhood obesity was already high at 19% before the pandemic, in the 2 short years since the massive shutdowns of schools and activities, the childhood obesity rate took another leap to a current prevalence of 22%. So that's not too hard to understand, because with schools closed, there was an increase in sedentary activity, an increase in consumption of unhealthy food choices, an increase in non-academic screen time, etc. And so I thought about what it would take to reverse this damaging fallout from the COVID-19 pandemic. And it occurred to me that some of the same strategies that were effective for the pandemic, for stopping the spread of the COVID-19 virus, can also reverse the childhood obesity trend.
So what are some examples of that? So you're seeing that increase in the prevalence of childhood obesity from 19 to 22%. So tell me some of the things and strategies that we can use to help reverse that.
Yes. So what I did in the article, I listed 5 strategies that we use. I basically compared what did we do in the COVID-19 pandemic to how we could use those same strategies. So I listed 5, and there are probably more, but these are the ones that I came up with. I started with recommending that we stop placing the burden of childhood obesity on individual responsibility. And I say that because when we look at the pandemic, we didn't leave the strategies up to individuals. We didn't say it would be nice if you wear a mask or if you shut down your business. We mandated some things because we recognized that in order to really stop the spread, we were going to need to have really a public health response. And so basically, that's what I think would work for childhood obesity as well. That most of the times we are telling our parents, our families, you need to increase fruits and vegetables in your diet, and you need to increase exercise, and you need to decrease screen time. And that's true, and we need to do that. But I think that if we mandated some things, just like we did in the pandemic, and in this case, it would be things like, school phys ed programs and school nutritional programs. Some of that is done, but not nearly on the scale that it needs to be, and that this would make a big difference if we made this more of a nationwide effort. Other things that we did, for example, we instituted actionable, simple steps in the pandemic. What was the message? It was 3 W's: wear a mask, wash your hands, watch your distance. And we need to, of course, we actually know what the actionable steps are for weight control. We know it's, healthy eating and exercise and limiting screen time. We know that's what it is, but we really need to systematize that as much as possible. And not only should we tell our patients that, but we should saturate the environment with that information. So by that, I mean, just like in the pandemic, when that message was everywhere, it was on posters, it was on billboards, it was on TV commercials. I think if everywhere children go, that message is there, encouraging them to make healthier food choices, encouraging them to exercise, take the stairs, or, go ride your bike for 30 minutes or things like that. Everywhere that they touch, that message should be there. And not only the message should be there, but the tools need to be there. Because with the pandemic, we didn't just say wash your hands, but there was also a hand sanitizer. There were hand sanitizers everywhere. When you walked into the store, the hand sanitizer was right there. I think we could do something similar for kids, that they're, like I said, everywhere they touch, there should be opportunities for healthy eating and exercise. We shouldn't have food deserts, for example. Healthy foods should be accessible in all of the places where they are, and physical activity opportunities should be abundant. Even outdoor free things like parks, safe playgrounds, things like that would make a big difference. And finally, I said one of the other things I suggested was the investment of money, because all of these things are great, but it takes an investment. We did invest quite a bit in making sure that people were protected during the pandemic. We invested in the vaccine. We invested in free testing for anyone who needed it and made it accessible. And I say we should do the same thing for making an investment in these things that we need for a healthy childhood, for reducing weight. And so it takes investment to have these safe spaces that I talked about, physical activity opportunities. Removing food desert takes an investment of our government. So that's the approach that I was suggesting in the article.
So I want to get back to your first point about relieving individual responsibility as it relates to childhood obesity. As you know, during the pandemic, there was a lot of pushback to some of these mandates. We do live in America where people do value their individual rights and freedom. Do you see any potential for pushback whenever something is mandated, especially as it relates to childhood obesity?
Yes, absolutely. I think there would be a lot of pushback. I think we've seen the pushback, even back, if you go back to the Obama administration and you think about how Michelle Obama tried to just not even mandate, but really push for healthier foods in schools, push for the Let's Move movement. And there was a lot of pushback. So I do anticipate that. I think we're talking about things that we pretty much can all agree on. We can all agree that we don't want our children to be at risk for chronic illnesses. We don't want them to be at risk for diabetes and high blood pressure and heart disease and all of these things. And what we really are asking for is not so much for mandates that impose on families, but more mandates allow the children's environment, like the schools, to have things in place. I really think it would be hard to argue that we should mandate physical activity in schools. We know we do have it mandated, but for example, a lot of schools, it may only be one semester out of or 1 year out of the 4 years of high school, for example. But we could mandate that. This is America, there's going to be pushback, but I think overall, we could probably agree on those types of things.
We're talking to Teresa Fuller. She's a pediatrician, and her Kevin MD article is titled Reversing the Impact of the Pandemic on Childhood Obesity. Teresa, so I think that a lot of these are policy goals that we absolutely should pursue. But in the exam room, I'm sure, I'm a primary care doctor yourself, so I'm sure that you know that there's a lot of time pressure on pediatricians. So what are some high yield things that they can do in the exam room to help reverse that trend of child obesity?
Yes, I agree. I experience that every day. You have your care visit and you're trying to address so many things. You're trying to address so many health issues. And so in the exam room, we definitely want to have, we want to make it as easy as possible. We want to give parents very simple, actionable steps. So one thing that I recommend and I try to do is have things written down so that it can be a simple handout. Some years ago, an example that I really liked was the prescription for exercise, where you actually give them a written prescription with some ideas. You can let them know what's in their own neighborhood. Many times people are coming to pediatricians that are pretty close by. And so we can let them know what are the parks and the locations in their own neighborhood that would be accessible, so that, because parents are worried about their children being safe as well. So trying to find those resources for parents. And once you gather all of that together, being simply able to hand it out or talk about it for 2 minutes or so and follow up. Those things, to have them come back. Let's see how you're doing with this. How's the weight going? Those types of things are simple. They do take time, but they can be done in a pretty systematic way.
And my final question, any take-home messages that you want to leave with the Kevin MD audience?
I would say that, a lot of clinicians are very involved in public health, and I think more of us need to be. I need to be, because I think what we're seeing, as we're seeing children in our practices daily, as we just talked about, and we're trying to counsel our parents and our patients to make these healthier choices, we also want to advocate for local and federal governments to make this easier for families. And so as we get involved in public health, push our governments to make public health a priority, to make these changes in the schools and in the environments that our children find themselves in a priority, I think we can make a difference as clinicians, not just in our exam rooms, but also on the larger scale.
Teresa, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you, Kevin.